likeness Kashi. My mom's name is Ndeshiwangisa Senyaeli. She is 60. She has a problem of knee replacement for many years, like 15 years. We tried different hospitals in our country, but knee replacement was worse. So they told us they can't able to do the good surgery in my country. They give us the referral to travel coming to India. So me and our family, we decided to sit and discuss about it. We search for the good hospital in India. We search and get different hospitals. Finally, we decided to come to Fortis. After reaching the Fortis hospital, we consulted the Dr. Narayan Hulse, and immediately we started the treatment.
I'm Dr. Narayan Hulse, Director of Orthopedics from Fortis Hospital, Bannerghatta Road, Bangalore. Now we have a very interesting case. Mrs. Senyaeli, she comes from Tanzania, who suffers from severe knee pain, since last 15 years, with an inability even to walk to the bathroom and toilet. When I was called to see her, she was lying down on the bed, dejected and unable to move her leg in the hospital. We tried to make her walk few steps. She stopped walking and sat down immediately without even walking for few steps. So that was her situation since last 15 years. You can imagine a person cannot even walk to the basic needs of the life. To the bathroom, toilet itself is such a pathetic situation. Now, when I examined her both knees were crooked because they were bent in the knee in wrong directions for more than about 40-45 degrees, making a weight bearing or balancing her body on that knee is difficult.
After reaching Fortis, we found that she has a problem also of heart, total heart block. Doctor decided that she's supposed to put the pacemaker before the surgery. So we decided that mom will start with the pacemaker. So the pacemaker process start and it went successful. After there, we go for knee replacement.
X-rays have shown completely destroyed knee joints because of a condition called osteoarthritis. She developed this problem many years ago because of the sheer neglect. Both the joints were completely destroyed by this time. We have a complicated patient with obesity and complicated with heart disease and also an inability to walk. That is why it is important that these kind of patients are dealt by multidisciplinary team and higher end of technology, something like Mako Robotic. So we got her prepared for the surgery. We did a bilateral staged knee replacements for her. During the knee replacement, it was one of the extremely difficult case because correction of the deformity, managing her bone loss, managing the soft bone, and also correcting all alignment was very difficult. In this situation, the Mako Robotic was very helpful because it helped us to correct her anatomy properly back to the normal state. She recovered reasonably well after surgery, even though she had all other medical issues. We mobilized her quickly and the wounds have healed nicely and she started showing good progress, started going to the bathroom, toilet, etc. on her own, and all happy end as she is almost now ready to fly back to Tanzania today. Thank you.
Finally, mom get successful treatment and now she's able to walk. And today is our last time. We came here for checkup and we are ready to travel back to Tanzania tomorrow. What I found here in India, doctors, nurses, and all the team of this hospital. They treat us very well. We enjoy the service, and we thanks. Thank you so much, Dr. Narayan Hulse. Thank you, Fortis Hospital, Bannerghatta Road, for the good service.